So, tell me about when your shoulder trouble started and how that developed.
In my younger years, I loved doing push-ups.
Okay.
So I would do hot push-ups. You know, I might stand right here and hit the floor, and then it would hurt the shoulder. I'd put 2 chairs out, and I'd do this. One-handed push-ups, switch them. Not a good thing.
You're a beast, but it took a toll on your shoulder. Okay. What type of work did you do?
I was a factory worker, machine operator.
Okay. And then you've been having problems with your shoulder for a good number of years.
Yes.
Okay.
On and off, to heal up and get better.
Any treatments that you used in the past, or interventions you used in the past?
Nothing,
Not much.
just non-use.
Got it.
Rest.
Okay. Describe what you feel and where you feel it right now.
I still have pretty good motion. Back here is not good, and then I have a problem with the bicep, and I'll wake up and it just aches, or try to get to sleep too, and it just aches.
Got it. And then do you feel like when you're holding things, carrying things like a load, that bothers you?
Yeah, it's usually, you know, down here, you know, or carrying something.
Got it. Okay. Fair enough. All right. So what we'll do an assessment of your mobility, see where you're at. Might shoot some measurements here, but we'll see where you're at. So first thing I'm gonna have you do, if you would, is let's take a look at, let me just kind of feel what. Is that bothersome right there?
Mm-hmm.
Does that bring on your symptoms? Does that feel very similar to what you feel?
Yeah,
Good. What if we do that?
I feel that right up here.
Okay, and that is what you feel when it bothers you.
Yeah.
Okay. You can stay there. We'll have you take your left hand, leading with your thumb, reach straight up and over your head. We're going to see what kind of flexibility you have on this side. Just going to measure that. All right, thank you. 163. And do the same thing on the other side, only at the point that's reasonably comfortable. In other words, don't put yourself out. So your mobility is about 14 degrees off right to left. Yeah, and you're right-handed. We'd expect his right arm to be more mobile than his left.
I'm ambidextrous.
Oh, you're ambidextrous? Okay. Up, arm up to the side. Thank you. And the other side. Tight. It's not moving very smoothly there, is he? I mean, he's probably about 10, 15 degrees off on that side too, but you sort of get the reach up behind your back as far as you can with your left, with your right. Yeah.
That's far enough.
Bothersome for this one too?
Well, it's tight.
A little bit. And the other side as well.
Yeah. But that's definitely far enough.
Okay. Let's check the rotator cuff muscle integrity, right? So first one is you were able to slowly lower your arms at your side. It's called the drop arm test, but we'll test it further. Bring your elbows in. Keep your elbows in, bring your hands out. We're going to check out your external rotators. Hold, don't let me move you, don't let me move you, don't let me move you. Good. Don't let me move you. A bit of weakness there. We wouldn't expect him to have profound weakness there. We don't have a strong suspicion of rotator cuff tears. We're going to check it out. Maybe take your left hand in your tummy, bring your elbow forward, hold your hand there. Don't let me move you. Don't let me move you. Thank you. Now switch. Right hand in your tummy. This elbow forward. Maintain yourself there. Don't let me move you. Don't let me move you. Bothersome there?
Mm-hmm.
A little bit. Okay. Bring your hands a little bit forward. Hold them there. Don't let me move you. Don't let me move you.
Sure.
Fair amount of weakness there. Okay. Elbow up. Hand back. Hold yourself there. Don't let me move you. Let's check in the smallest of the rotator cuff muscle, the teres minor muscle. Now push forward. We're checking for signs of instability in the shoulder joint. Any bother with that?
Not too bad.
Okay. Raise your other arm up. Hand back. Don't let me move you. Don't let me move you. Decent strength there. Push your hand forward. Any bother there?
Yeah, I can feel it coming forward.
Feel it coming forward. Okay. All right. right, if you don't mind, maybe perhaps kick off your shoes and then lie on your back. Check out some other motions lying down in your back. I'm going to block his shoulder blade, and we're going to see how much his ball and socket joint move in a number of ways. Relax, allow me to move you. I'm not going to do anything tricky, sudden, or forceful. If I block his shoulder blade, this elbow should come up to about his bottom of his earlobe. He gets up to just a little bit beyond a right angle or beyond the shoulder. This side is a stiff shoulder as well, actually. I'm going to see what you can do with hand back. Ideally, this should go easily back in line with the table. A bit stiff there, but not bad. We're going to check turning in. Fingertips should come close to the table. He's got a bit of stiffness in that one as well. You said this one bothers you as well? Sometimes?
Sometimes.
Sometimes? Okay.
This is the one that, it's leaking right now.
Got it. Does that ease up the aching a little bit?
Yeah, irritated.
What's that?
Irritated.
Is it less irritated with your hand here?
Oh, no,
compared to
no,
down
just in general from
Okay.
what we've been doing.
Got it. Any bother here? No. So again, his elbow should come up to about his ear, if you will, if I block his shoulder blade there. Let me see what kind of motion he has here. Okay, bring this up. So on that shoulder model, if you don't mind grabbing it right there, huh?
Oh, yeah.
And this type of motion.
Mm-hmm.
Okay. Have you ever used anything on that? Creams, lotions, anything like that? Okay. Would you mind grabbing one of those containers of almond oil? So he's got, oftentimes people self-diagnose themselves. Sometimes people are right. He does have what I would call bicipital tendonitis, right? So, good job. Should you Google that or just know that's where it's at?
I just know it's bothering me.
Yeah. So I'm going to do a couple things here. First thing I'm going to do is see if we can't create a little bit easier motion for that biceps to be in. If you don't mind, stay on your back, but slide towards me a little bit. Good, thank you. And I'm going to do something that we call joint mobilization, which is loosening up that shoulder joint capsule to allow for a little bit easier flexibility and movement there. So he's supported here. I'm not going to do anything sudden, tricky, or forceful. I'm just going to give a little bit of gentle movement into that ball and socket joint to create a little bit increased flexibility there. This should be comfortable. Right now, with your arm in this position, any discomfort? Great. I'm going to give you a little bit of traction there. And then I'm going to give you just a little bit of pressure there to get a little gentle stretch through that shoulder joint capsule. You might feel a little bit of shift in that shoulder joint. Sense that a little bit?
It feels good.
Feels good, right? We're taking some pressure off of that joint, if you will. So his biceps tendon comes up on the upper arm joint. I'm actually taking the upper portion of his upper arm and I'm pulling it down towards his ankle a little bit. Selectively in that joint. This is called joint mobilization. So these joint structures have pain receptors and movement receptors inside of them. So for Jerry, most of the time when he feels his shoulder, it's painful. This gives him different sensations other than pain and allows for increased flexibility in that joint so we can start to interrupt that pain response. So he's got stiffness in the shoulder, joint capsule. He's got irritation in that tendon, and he's most likely got some sensitivity in those nerves.
I'm a train wreck.
If you had to, you could probably wrap off some push-ups.
I could do it, but then I would pay for it, right?
Yeah, you pay for it, right? So, now he likely has some imbalance in muscle strength. So as a young man, he did lots of work to develop his show muscles, right? His triceps and his chest, right? And maybe he didn't do so much work to strengthen his upper back. And over time, that may have created an imbalance between the back and front muscles. Does that sound accurate?
Sure.
Yeah. Most people who do weight training, especially men, they don't do a really balanced approach, right? I mean, I'm a guy. I was guilty of that too, right? We're doing a little bit of motion now, going up and down this way to loosen that joint up. Comfortable?
Mm-hmm.
So you did get to Riviera Maya though, right?
I did.
Like no one just bought you the t-shirt and made you stay home? Okay.
Yeah, she let me go with her.
That's nice of her.
Yeah.
Okay. I'm going to block that shoulder blade again. I don't know what kind of change we're going to induce here. I mean, he's had this for a long time, but we're going to check it out. I'm blocking that shoulder blade again and saying, how much will this raise up? Any bother with that?
Mm-mm.
Anybody notice a difference with that compared to before?
Absolutely.
Yeah. You feel the difference with that?
I do.
Yeah. So here's the thing, is we know that this tendon is irritated. I believe treatment has to be directed here too. If we only direct treatment at the place where the yowie is, then this other stuff that's helping to contribute to that is not going to get better. Does that make sense? Or it's not going to change much, so it's going to be hard to keep that. So we're going to expand this treatment, right? So this is one aspect of it. I'm thinking I could retest that sensitivity. How is that area now?
I still feel it.
Still feel it.
Irritating.
Yeah. So he needs some assistance there, but let's check him. Have a seat, please. One thing, just have a seat for a moment. I'm gonna lower the table here. One of the things we like to do, if someone has MRIs and X-rays, or I think we need them, I'm happy to help obtain those, right? My confirmation of whether or not I'm right is to assess his movements. Jerry, I'm gonna have you.
Oh.
We're not done with you yet.
I thought I was sitting there.
No, sorry, just sit right here. I have confirmation of, does this affect that person's pain or movement in real time? If it does, then I know, check. That's something that we want to add to his plan of care, right? If it's not, either I didn't do it right, do enough of it, or there's something else that needs to be done, and we don't do that, right? So we start to add things that are helpful and stack helpful things. So if you don't mind coming up to standing. So we're looking for what we call a within session change. This is the definition of this 5-minute miracle, right? So if you would please, I'm going to have you take that right arm and reach it up over your head again in front. Notice what that seems like for you. And come back down. What do you notice about the quality?
Back further. Behind his ear.
The quality of movement was different. You don't need to be a trained clinician to see that.
Right.
We're humans. We can see when quality of movement has changed. What did that feel like for you compared to the
Felt better than the first time.
Nice, good. And then up to the side may also be changed. We don't know. Check it out. Nice. Good. Super. Check. We need to include that in his plan of care. Certainly, he's going to need some direct treatment to that biceps tendon that's been irritated a while. He may very well have some stiffness in his upper back that's feeding to that, and neck. So we want to make sure that we treat everything in this area and whatever's contributing to this, so he has the best chance of lasting success. So, nice job. So,
I feel like.
oh, you felt that? Oh, sorry.
No, not that. The abuse.
The abuse, yeah. So, for someone like Jerry, I mean, obviously, this isn't all that he would need. We need to move through probably other things as well. In particular, find out, okay, what do you want to be able to do? Do you want to get back to push-ups? Okay, if you do, then we need to kind of create a plan so that when he does them, they just irritate them and slowly build that tissue back up. But chances are we're going to need to do significant amount of work for the other muscles to take off some of that work as well. So create more space for that ball and socket joint to move, lessen the irritation there. So some treatments might include some deep tissue massage. I was going to use my fancy deep tissue massage, the side blade of a massage tool, or that I use as a massage tool. We have those as well. You'd likely benefit from that. He may really benefit from some dry needling, which is the use of acupuncture needles. If he doesn't like needles, that's fine. We don't have to use that, but that's one thing that might be really helpful. That can help dry needling. People familiar with that?
Mm-hmm.
Yeah, it's the use of acupuncture needles without injection to help decrease nerve sensitivity and to promote healing. People get better without it, but that might be a really good option. He may actually benefit from something that I don't really use a whole lot, and that's ultrasound. If it's a small area of irritation, that might be beneficial. So we could start to talk about the sort of things and stack that. We didn't do quite a full examination, but that was pretty close. Like I might talk to him a little bit more and talked about his pain patterns and such. Another question is how long might that last? I think if he doesn't do anything in terms of a new flexibility exercise or a new way to reach, it may last a few hours to a few days. He's going to have to do more. His body wants to pull back into old patterns, right? So in a treatment plan of care, what we look at is a reasonable expectation and understanding of, hey, you're going to need so many sessions over so many weeks. Early on, we're interested in relieving pain. We're interested in improving flexibility, calming that nerve down, and then over time, the next step is we want to increase strength in the supporting muscles that need to be increased. We want to restore appropriate posture relative to what he needs, and then eventually get to a point where he's got a developed program in which he does pain relieving exercises, flexibility exercises on a more regular basis, a few of those. And then maybe a few times a week he's doing higher level strength and conditioning in line with what he wants to do. If he wants to get back to, I don't know what his life is. I don't know if he likes to fish or hunt or golf, or work out, whatever that is. We want to make sure that we have a program that allows him to do that and build up to that as opposed to just adapt to it and avoid it, right? We want to get him not only feeling good, but back to his active life. Yes?
So say he wanted to get back to doing push-ups. That's one of my things. I can't do push-ups anymore. So during the course of therapy, is the push-ups out? Don't do them until you do work your magic, or is that realistic that he can get back to push-ups like he wants?
So I think that like two things in the shoulder that come along later in recovery are being able to raise your arm up to the side with resistance, like with weights, and doing deeper push-ups, right? If it bothers, probably don't do it. Can you get back to it? Absolutely.
But will that cause the problems all over again? And
if we properly manage all the other stuff, no. Right? So there's like some folks would say, don't do push-ups after a certain age. I think that's silly. But don't do push-ups if it's irritated. And if it is irritated, let's find a solution to get back to them, right? So there's different ways that he can start to train. Maybe when he starts training, does the top 1/4 of the movement, and maybe without those elbows splayed out, maybe with them in a little bit. Or if that's a lot, maybe he goes back to kneeling push-ups. Or maybe he uses light weights to start with, right? So I'm a gym guy, I like, if someone wants to be active in the gym, great. If they don't want to be, that's okay too, right? So it wouldn't matter if it's swimming. Like if he was a swimmer, and he wants to get back to swimming and that's his thing, well, let's figure out a way to get back there. Let's not just accommodate to it, right? I'm probably not going to encourage him to become a competitive overhead power lifter.
Okay.
But if he wanted to, and we set up reasonable expectations, I think we could train for that. I mean, he's not ancient. He can get back to it. Even if you're older, we see folks in their 70s, 80s, 90s. We don't have an upper age where people can't get stronger with things. People are more adaptable when they're younger, we got to admit that. But we're smarter as we get older. So we can use that to our advantage, right? So,
Well, we lose muscle mass as we age.
and muscle mass can be replaced, right? You can start to improve that as you know here. So that's kind of what a treatment plan looks like. So that's on the wall. We have 4 phases plan of care. First is relieve pain and inflammation. That's in the red. Second is correct the root cause of the problems, which is oftentimes joint and posture imbalances. Third phase is build strength, so that people can get back to the sort of strength that they need to get back to their life, work, and hobbies. And then the last stage is preserve, build up some robust nature. So at the end of it, you're a robust human being that can do the sort of things that life will demand of you, right? So people, whether they like it or not, they're already weightlifting, right? They're lifting upper laundry baskets. They're trying to put stuff into upper cabinets. They're oftentimes doing overhead stuff in yard work. So you're already doing it, right? It's just a matter of, are you doing it in such a way as you're causing irritation? And some people don't want to lift weights. That's fine. That's not the focus of it. It's whatever you want to be able to do. After someone's done with a plan of care, they don't have to do anything. Most of the folks that I see on the street who are doing really well, I ask them, hey, how's it going? Oh, pretty good. You still following the program? Yeah, pretty closely, right? That helps. That helps stack to being able to not have that problem again. So, cool. I'm gonna continue onward. So if there's other questions about Jerry specifically, good session, by the way. So, I have I think one episode where it didn't work out in 5 years. So this guy had probably a massive rotator cuff tear. That's a little bit about what we do. So the next step is that we're certainly happy to invite you in. You've got a number of things, resources. Some of you looked through them already. Some of which is testimonials, some folks that we've helped in the past. The other is folks that show up. We're happy to extend a complimentary what we call discovery visit, and that's where you can come on in and get a look, just like we did with Jerry here, to see what's going on in your circumstance, perhaps do a trial treatment, see what kind of options are available for you. We're happy to let you know what that looks like for you in terms of afterwards, what that looks like for potential number of sessions and your costs. We can run an insurance verification and let you know what your costs would be at the end of that session, so that you know what that scope of work looks like.